So for quality control management, important topics. Again, the first page, function and expectation of quality, expectations of hospital administration, expectations of your patients. What do they mean by quality? What does the hospital means by quality? Okay. Focus on page number 3. Okay. And then dimensions of 6 dimensions of quality from the hospital's point of view, 5 dimensions of quality from the patient's point of view. Okay, be thorough with that. Then cycle of quality management, the entire chapter. So it starts from measurement. First is measurement data. What is measurement data? Categories. There are from page number 8 to 19. There are tables also. Tables will help you to understand measurement in more detail with example. Then evaluation. That is the second step of quality management. Evaluation steps. Okay. Evaluation tools. Histogram, pie chart, radar chart, all those things will come under evaluation tools. Okay, that is page number 21 onwards. Then we have SMART, the SMART techniques, SMART objectives, specific, measurable, attainable. Okay, so the abbreviation of SMART, complete abbreviation of SMART, you should be thorough with that. Then improvement steps, a small figure is given on page number 30. Read that, be thorough in that. Then models of improvement, Kaizen Blitz, 5i, then 5S, all those techniques, Lean, Six Sigma. In short, they have given. Read that thoroughly. Medical legal chapter, the entire chapter is important. Nothing can be missed. Okay, especially the last few pages. Sections, no need to by heart the sections. Okay, understand the difference between warrant. Okay, what is a warrant? What is a summon? Okay, res ispa, loquitur, excuse at non jurisdiction. Okay, all these things, be thorough with that. Patient management guidelines, just read once. Okay, only conceptual questions will come from patient management guidelines, 43 and 44 page number. The international patient safety goals, very important. 6 goals are there. Be thorough with the 6 goals. Theory is given under each goals. Just read it. Your concept will be clear. And also recordings are available on the YouTube. You can revise it using the recordings as well. Spectrum of services, again, only the important points. Patient rights, read the points. There are 11 patient rights, read the points. Some examples of patient rights will be given. You have to identify, is it a patient right or not? Some wrong statements will also be given. Okay, so be thorough with the 11 points. Go through the quality standards only once. Okay, only conceptual questions will come from quality standards. But as soon as you read the question, you will understand what the answer should be. Okay, easy questions will come from quality standards. Organ transplantation, important chapter, 58 to 61 page number. Okay. Blood transfusion, again, conceptual questions. Then surgical safety checklist, page number 65, WHO surgical safety checklist. Tricky questions can come from here. Be very thorough with the surgical safety checklist. Go to Google, just type WHO surgical safety checklist. You will get the official one. Okay. Be very thorough with all the 3 parts in the surgical safety checklist. Okay. Tricky questions you can expect from here. Then medication management, only the steps, just read it once. Okay, only conceptual questions can come. Medication errors, very important chapter. We may give you some examples. You have to identify what kind of medication error has took place here. Okay, so be very thorough with the different types of medication errors that has been mentioned. Sentinel events, examples of sentinel events. What is a sentinel event? What are the policy the hospital should have towards sentinel events? Okay. Then near miss events, 76 page number, examples. Then prevention and control of infection, just steps, read once. Okay. And read once all the page numbers, all the quality standards. A bunch of quality standards are given from page number 79 onwards to 86. Food safety, 87 to 95. All the classes of food. Okay, what the duties and responsibilities of a food safety supervisor, and food hazards, food safety hazards. So these are the important aspects from this page number. Facilities management standards, 96 page number. Then hazards management, waste management, all the tables. What the WHO has given, only that tables we have mentioned here in waste management. Be thorough with that. Disaster management, the steps included. Conceptual questions will only come from disaster management. Don't worry. Fire safety, page number 103 and 104. The full form of RAS. Okay. RASS. That's an abbreviation. You go and read what is the full form of that RAS. Okay, such abbreviations will come. TB infection control, that's 10 steps. Only the 10 steps you have to be thorough with. The theory part, just read and understand what it means. Okay. Utility management, read once. And so certain points are given for utility management. How much potable water, how often potable water has to be checked, how often non-potable water has to be checked, where you have to keep, why you should lock the water tank and keep. Okay, such important points are given on utility management. At the end of the chapter, some important points are given. So read that. Water supply tables and point for OPD visit. Per OPD visit, how much liters of water is required. Per IPD visit per day, how much liters of water is required. A table is given that you have to be thorough with that table. Okay, the water requirement table. Then accreditations from 172 to 177, all the accreditations, JCI, NABH, NABL, ISO. Okay, be thorough with that. Then power, communication, and washrooms, just read once, conceptual. Okay, just reading, you will understand what kind of quality standards do we expect here. Okay, hand hygiene, again 5 moments. Labor room, questions will not come from labor room, it's just for your knowledge. Only a table is given, just read that once. Don't expect any questions from labor room. ICU planning, the entire chapter is important from page number 128 to 151. Focus more on the levels and the facilities in ICU. Okay, noise levels, lighting, facilities in ICU, furnitures, etc. Okay, HDU and ICU difference. HDU is on page number 152. The difference of HDU, ICU. Why do we need HDU? Okay. And HIV services, all the tables. HIV services is a bit long chapter, but only focus on tables. Waiting area, and that is also part of HIV services. Pharmacy, tables. 5S model. 5S model is important for the infection control students, quality, as well as Six Sigma students. If anyone has any questions, put it in the chat box. We will discuss on that later. Okay. MRD, read all the points only once. Don't by heart anything from the MRD. Don't by heart anything from the EMR. That is electronic medical records. Okay. Just read the points once. That is more than enough. Okay. Sample questions here for quality control management. Res judicata doctrine means what? The answer is things have been decided. Some options have been given. The correct answer is things have been decided. Okay, like once a judgment has been passed and it has been carried out, you can't try the same perpetrator for the same crime over and over again. Okay, so that is things have been decided. Then for noise level in ICU, what should be the noise level? At night, okay, in ICU you will find at morning, daytime, evening, and night. Okay, in 4 different time periods of a day, what should be the noise level in ICU? Table is given in the chapter. Okay, so at night it is below 40 A-weighted decibels. Okay, if you are thorough with the numbers here, as I mentioned earlier, ICU chapter is very important. The noise level, lighting, levels of ICUs, etc. Level 1, level 2, level 3. That is important. Focus on that. So these are the sample questions you can expect from quality control management.